we will have fully furnished hospitals within the informal settlement, treating people of a less advantage or informal settlements.
These hospitals are actually better than the many private hospitals that we have, and they are actually better than standard level 3 hospitals in the whole country.
Tunashukuru ni venye yani tuwezi kupata badi hivi one on one, tumshukuru.
I can tell you for sure, personally, I am really happy and I feel proud of my country.
According to the 2019 census, Nairobi County is made up of 1.5 million households with a population of 4.5 million, although the exact number of disadvantaged households is not quantified. Out of these 4.5 million people, 65% depend on public health facilities. Most of them reside in informal settlements, thus the need to set up health centers in those areas.
We also mapped out in the informal settlements, and we realized that 47% of people who get stuck at Kenyatta National Hospital are people from informal settlements in Nairobi. So they go there, they get the service, but then they get stuck in the hospital. The reason why they get stuck in the hospital is because they can't pay. Kenyatta is a level 6 hospital, but there is no level 5 hospital, and then the level 4 hospitals are overwhelmed, and then the health centers and dispensaries are not accessible because they are few in number.
In addressing this challenge, the government of Kenya, through the Nairobi Metropolitan Service, embarked on a mission to overhaul the sector to ensure that Nairobi County residents had access to universal health coverage as enshrined in the Big Four agenda.
We mapped out Nairobi, populated places, high disease burden, high maternal mortality, high malnutrition rates. And where is this place? In the informal settlement. So we took 9 informal settlements, we mapped out and we built 24 health facilities.
NMS, in collaboration with the Department of Social Services and the Ministry of Health, identified vulnerable households and sent them up to the Universal Healthcare Insurance Scheme made available by the National Hospital Insurance Fund, NHIF. This initiative is in its initial stages, and the main target is to cover at least 20% of Nairobi's poor households during the first phase using a tool developed by the Ministry of Health. According to NMS Chief Health Officer Dr. Oluga, NMS uses 2 criteria in identifying vulnerable households. These are accessibility of the area and the type of household.
What else we've done is to make sure that we are registering 66,000 poor and vulnerable families, again from the informal settlements. So we are paying a full year NHIF to poor and vulnerable families.
Since March 2020, when Nairobi Metropolitan Service commenced the renovation of informal settlements, health facilities in those areas were included in the upgrade program. Less than a year later, state-of-the-art facilities has been erected with the one perceived neglected areas of the city. A good example of these are the Kiamaiko Dispensary, Kayole Soweto, Ushirika, and Muthua Uthiru health facilities, including 24 similar medical facilities. All these healthcare facilities range from level 2, level 3, as well as a referral hospital that is currently under construction in Mathare slums.
There's a big hospital there that is being constructed, 350 bed capacity hospital. The hospital has stalled for 30 years.
The Nairobi Metropolitan Service has already hired an addition of 2,000 medical staff, including doctors, nurses and midwives, to boost service delivery in various health facilities, especially in the newly built facilities.
It is not the fact that we put a building. It is not the fact that we brought an X-ray. It is not the fact that we have an ultrasound. It is not even the fact that we have a modern theater. It is the fact that you can get a well-trained doctor.
Some of the services offered at the new facilities include both curative and preventive service, family planning, as well as counseling services.
The services that are offered in this facility, we have curative services whereby we treat all the clients with all different cases. We have promotive services, we have preventive services, that is immunization for all the mothers and even their children, and even counseling services for those who have issues supportive services, and even special clinics that include the diabetes, hypertension, and some of the chronic illnesses like asthma.
We have maternity. That is our mainstream, maternity, and trying to offer maternity services in the area.
Residents in these areas have expressed their deepest gratitude towards the NMS. They could not mask their excitement as they visited the health centers for the first time. Unlike private hospitals, these centers offer services at no cost.
Kuwa na hii dispensary hapa inamaanisha a lot kwa sisi, kwa sababu sasa tutakuwa tunapata services ambazo si expensive, ni cheap na ni free. Ukitoka anytime tutakuwa tunakuja na tunazipokea hizi services. Tunafurahi na tunashukuru.
Wametusaidia kama sisi wanafunzi pia wa hapa Kabete. Tulikuwa tumeshughulika sana kuenda Westland, Kawangware kutafuta hospitali, but hapa naona tu kuna ile furaha ya kwamba tumepata hospitali karibu na sisi.
Tumesaidiwa na hii hospitali because hapa awali mtu alikuwa anabidi aende Kangemi ndio apate matibabu. But saa hizi naona things have been easier because tuko na maternity na mtoto akigonjeka hakuna haja ya kwenda mbali, unamleta tu hapa karibu.
Hapo awali tulikuwa na shida hospitali kweli, like mimi hata mtoto wa kwanza na wa pili wote ilinibidi tu niende Isili, lakini saa hizi nashukuru hospitali iko karibu. Kama leo tumeamka mtoi asikii vizuri, anakohoa na mwili moto, nikasema acha tuende tu hapa hospitali ya karibu yenye tumejengewa sisi tukahudumiwe.
According to health workers, the first day of operation saw an overwhelmingly high number of patients turn up, an indication that the residents in these areas were in dire need of accessible and affordable health services. For instance, the Kiamaiko dispensary received over 100 patients on the first day, whereas the Mudhwa Uthiro Health Center received over 150 patients, most of whom were seeking prenatal and postnatal services.
The first time we had contacts with patients, the first time we opened the facility, we had 150 patients, first day. Today is the second day now, and we've had over 90 patients by 12 noon. So that shows that it will be a very busy facility, which means residents here were suffering from a shortage of the health facility being nearby. So this facility being here will actually serve the purpose of the entire community at large.
This facility is of importance to the residents of this Kiamaiko slum, given that they can be able to access the services and free of charge.
Because these people do not have health insurance, you must give them hospitals that are free. Hospitals that are free according to the law or according to the gazettement is level 2 and level 3.
During the commissioning of these facilities, His Excellency the President reassured Nairobians of the government commitment to ensure the success of these undertakings.
Miezi 6 iliyopita hii hospitali ilikuweko. Si sasa imesimama na iko na madaktari na wanawatibu. Hiyo ndio sisi tunataka kuleta huduma karibu na mwananchi, kuhakikisha ya kwamba wale wananchi walikuwa wanahangaika kutafuta hospitali, sasa tumewaletea karibu. Si ni namna hiyo?
The health facilities program in Nairobi County continues, and NMS is confident that its goal to ensure all Nairobi residents have access to affordable and quality healthcare services will come to fruition. The government has heavily invested in equipping and staffing each new facility. This undertaking is unique in that NMS and hospital management have put in place a code of conduct and training for workers to ensure that they diligently serve Mwananchi.
Through UNFPA, we started retraining, for example, of nurses. And we are not retraining them on how to treat people well. All doctors are well trained. All nurses are well trained. In fact, Kenya has some of the best. But it is the environment. And we are retraining them on issues of attitude, on issues of how to handle patients with dignity. We are retraining them on human rights approach.
Additionally, NMS has also secured performance warranties from manufacturers and suppliers for all hospitals' equipment, which ultimately ensures that service delivery to residents is not interrupted by faulty machinery.
The contractor who is supplying the equipment also has the responsibility, 3 years, to maintain the machine. So tomorrow, we cannot say the machine is not working because it's still the responsibility of the supplier to make it work.
In order to make this process a success, health personnel have pledged to give their best in serving Mwananchi. They also urge residents to make full use of these facilities.
The promise that I want to give the Soweto community is that the facility is fully equipped under NMS with human resource and material resource, and we are going to work hard, do our best to make sure that we give all, like 100% to this community, and no more suffering for all the clients in this community.
And what I just advocate is if they come in numbers and we see there is need to increase the capacity, so the capacity will also increase, and making it a bigger and increase the ranks of the hospital from a level 3 to a level 4, and eventually, who knows, even it can be a referral hospital. That's my main goal.
Tunashukuru ni venye yani tuwezi pata badi hivi one on one, tumshukuru. Tumeona mpaka garbage, ukiangalia mpaka drainages zimefunguliwa, kuna lami. Tunashukuru sana na tunasema afanye kazi kwa bidii.
NMS ibarikiwe na izidi. Yani wamefanya vitu mob. Wametuletea mpaka maji.
I can tell you for sure, personally, I am really happy and I feel proud of my country. NMS coming through actually showed me that there's actually, I had hope, but NMS has given me that hope.